Hi, this is Kerwin Gaines from the agenda, normally. Tonight is going to be a little different. We're going to have DETV's COVID conversations, and just not with me for an hour. We're going to speak with Dr. Bruce Nesbitt from St. Francis Hospital. He is the head of emergency services there. He's going to tell us a lot about what's going on with COVID here in the state and how it's affecting the healthcare system. This will be a week-long webinar series that we'll have here at DETV. And we hope just not to inform you about what's going on, but motivate those who have not gotten their vaccination to go out and do so. And if you're not sure, if you think you may have it, to get tested. And get tested for your family and get tested for loved ones. Dr. Bruce Nesbitt, welcome to DETV's COVID Conversations.
Thank you, sir.
Right now, I understand that it's a very difficult time for healthcare workers throughout the United States, but especially in Delaware. We are surrounded by states that have rising levels of COVID and COVID infections and new cases. But I know that it has been a tremendous strain on the healthcare system, especially St. Francis with a high density area like Wilmington.
Yeah, the last couple of weeks have been unbelievable. The rise in COVID cases over the last 2 weeks has been astronomical. No one could have predicted this. The early news out since South Africa was concerning, but seeing it happen and the cases almost double by the day has been, frightening.
I can only imagine. How are you all holding up? You all, as in medical professionals in this great city of ours, how are you holding up? Because it's a great deal of stress and I guess numerous hours as the population of infected individuals increases and you're forced to care for all of them. So how's it going? Not just you, but nurses and paraprofessionals in your organization?
Yeah, it's been challenging. I'm feeling very fortunate to do what I do. I feel like it's a privilege to treat patients and be a physician. The hospital and hospitals across the nation are under a ton of strain, particularly for nursing. From a physician standpoint, we have no problems, but there are certainly nursing shortages, as I'm sure you're aware, throughout the state, throughout the nation, that we are not exempt from. So it's tough because everyone wants to provide great care to every patient that comes to the emergency department. But the last couple of weeks have truly been, more challenging than early in the pandemic when we had the initial spike, and even last January or this past January, which, was a pretty rough time because that was, pre-vaccination basically as well, this past January.
Using, I guess, layman's terms or my basic knowledge of medicine, would you consider a recent influx of those that are in the hospital right now due to infection, possibly the Omicron virus? Is that due to Thanksgiving activities, possibly from those large gatherings with families? And now a couple weeks later or 4 weeks later, we're seeing the influx of that?
Yeah, I think it's a combination. I mean, Omicron's ascendancy in the US has been unbelievable, right? So about 3 weeks ago, the percentage of Omicron in the US was about 1%. And I think as of last week, it was about 74%. So to go from 1% to 74% in the space of 2 weeks is unheard of. So I think it was going to be bad regardless. It just seems to be so much more transmissible than Delta. And, Delta was kind of scary. That combined with the holiday gatherings and whatnot, it's, yeah, perfect storm.
Like it was just two trucks that have collided. That has been the holiday schedule and a highly transmittable virus such as Omicron version of COVID-19. It's been very hard. Now, are you treating that any different than the Delta variant or the other variants that have occurred with COVID?
Not really, actually. I guess there's positives and negatives. Some of the data suggests that Omicron isn't as severe and doesn't lead to as many hospitalizations as Delta. The problem is because of the mountains of new patients being infected every day, that even if on average the severity is lower, if you have so many more patients, so many more people infected, you end up with more inpatients. And I think that the census within the hospital system of Delaware is at, close to the level it was at its peak this past April. Um, so did that answer your question?
Yeah, I believe so. So I mean, it seems as though we're getting 2020 numbers in regards to census, and the output is
Yes.
if you're sick, you're going to be in the hospital, and if you're in the hospital and you're infected, you're going to show on the census data of being infected and being sick, and that's why our numbers are on the
Right.
rise.
Yeah, so
Right.
actually, one of your other questions was, are we treating it any differently than Delta? You know, and here's the truth, and I don't think this is well appreciated, is that the treatments for COVID-19 are not particularly effective, right? Vaccinations are extremely effective, right? And so often we see patients, and one of the common themes is that a lot of patients never believe it will be them that gets infected. And then they get infected,
Right.
get quite sick, and then ask, oh, well, can I get, the antibody treatment or can I get the vaccination now? And, nothing beats the efficacy of being vaccinated, fully vaccinated and boosted if, you're ready for the booster. I mean, it's so invaluable and it's so simple, quite frankly.
And just so I'm clear, and for our viewers that they're clear, is that if you are infected or if you were infected with the COVID virus, that's not a cure. It's your antibodies last about 90 days. Correct me if I'm wrong, and then you're back in line of being susceptible to this horrible virus.
Right, so there's a gradual degradation or decreasing in the efficacy or the number of antibodies you have, right? And then you get the second shot, right, 30 days after the first shot, and then your antibodies spike again. And then there's this slow descent. And we know, it's funny, just a couple of months ago, right, there was controversy over whether people should be getting boosters at 6 months from last. Now it is hands down so obvious that that needs to be the case. And I wouldn't surprise me if the CDC um, changed 6 months to 3 or 4 months, in the near future, because I personally am seeing a lot of patients or some patients who with breakthrough infections who got their second dose of Moderna or Pfizer or J&J back in May, right? May's now 8 months away and they're susceptible to breakthrough infections. Now, they still have some protection, and having had those vaccinations, they're in much better shape and have much better outcomes than someone without any vaccinations. But we're seeing a lot of those breakthrough that haven't yet got boosters.
Okay, asking an obvious question. The people that you are seeing that are coming to the hospital that are infected with COVID, are these folks that have been vaccinated or are these folks that have not been vaccinated in general terms, of course?
So the ones that need to be admitted to the hospital are almost all unvaccinated, right? So, and I think the numbers for the US is, I think, 90% of COVID inpatients, people needing to stay in the hospital, are unvaccinated, right? The risk of being hospitalized with COVID is almost 20 times greater if you're not vaccinated. Are we seeing breakthrough infections? Yeah, we're seeing some. They rarely, need to be admitted though. They're really generally not that sick, particularly, ones who've been boosted. I've seen very few of those, and they tend to have, quite mild illnesses and are more looking for testing before they go to, a family gathering or something.
Right. So are you expecting a big bump now because of Christmas? And well, I mean, it's two holidays back to back. I mean, New Year's Eve could be just as bad as Christmas as far as gatherings go. Are the staff ready for this influx of possible patients that could be coming in? Or do you think it may not be an issue?
It will be an issue for sure. It's going to be an issue across the US. I think the resources that are available to take care of patients are at their limits. Um, and, there's not that much more that can be done from providing care for patients. And again, I think that's true across the US and Delaware alike. So yeah, I think that January is going to be very difficult. And, I think it's quite sad, quite frankly, because certainly as a
Yes.
physician and as a medical director for the department, I want to be able to provide great timely care to everyone that comes. But that really is not proving to be reality with this surge. Um,
Yeah. Yeah, I believe the same thing. Now, I can't ask you to quote on every hospital that's in the state of Delaware, but as far as St. Francis, the hospital that you represent, are you prepared for January? Are the resources there for you? And if not, what plans are in place to help with this issue?
Well, I mean, administration of the hospital does daily huddles to try and problem solve and see how services and patient care can be maximized, right? But, there's a finite number of nurses. There's a finite number of techs. Um, and so there's a limit to what can be provided. I think that's the reality, and there's no real sugarcoating that. I think that people in the hospital are making great efforts, and the people I work with are absolutely wonderful. Just work tirelessly in difficult situations to do their best, right? But at some point, you know, the hospital can't provide anymore.
I mean, we're vastly approaching 24 months of COVID and how it's affected this and how it's affected our state and this city. So, question kind of off the beaten path that's sometimes not brought up. How is the mental health of healthcare professionals holding up in this grave time that we're going through? And what outlets do they have?
Great question. I think it's challenging when patients, I mean, certainly in emergency medicine, we know we go into something that's unpredictable, and to some degree, that's kind of a badge of honor that we can adapt. But I think it's tough. I think it's tough when um, patients are stressed and can be more challenging to work with. I think that's the hardest thing for healthcare providers. That um, and Yeah, I think that is what takes its toll the most, right? Is um, when patient interactions become harder, and they are, to some degree, understandably frustrated. I mean, there's still,
Right.
plenty of fabulous interactions we have, but you know, um, that's the hardest part for me personally, I think, and I think for a lot of people on the front lines of healthcare, is like we kind of love what we do. We chose to do this, but you know what I saw? I saw this sign the other day. It wasn't at the hospital, but I thought it was so apt and said so much. It was something to the effect of, "The whole world or the whole nation is understaffed. Please be kind to those who came to work."
Absolutely.
And I just think that's powerful, right? Like we know that tons of industries are understaffed, right? And lots of industries are suffering from lack of hiring, but healthcare is the rawest, right? Because we're dealing with health and it's so powerful. But so I just think that would be a great message, for if I could have one thing for the sort of the patients and the public to just kind of remember that, just kind of be appreciative of the frontline workers that have done so much in the last 2 years that are still here
And
for you.
it should give a reason to those that are unvaccinated to say,
Yes.
hey, again, as I tell people every day, especially on our show, if you can't do it for yourself, do it for someone else. And do it for the healthcare workers. We have yellow ribbons for
Mhm.
our armed services. We support our firefighters. We support our police officers throughout this country and so many other emergency service workers. But sometimes the nurses and the doctors, the ones that are giving the critical care in our communities, are oftentimes forgotten. So this can be an opportunity, and I don't want to say it's an excuse, but a reason for those to go out and get vaccinated.
Absolutely. And, can say that since April, the emergency department in St. Francis has offered vaccinations to patients. So when I see patients, I always ask, are you vaccinated? And if not, do you want to be, why not? What are your hesitations? And I think it's been
Right.
a, fabulous service to not only to the patient, right, but to your point, to the community, right, to their family and the community. Like we're kind of in this together. And,
Right. It's
we
just
offer
not
booster
about
shots
you.
as well. No,
Right. It's
exactly.
just not
And,
about you. It's just
mhm.
it's more about your community.
Right. And I remember when we first got vaccinations, I remember I was vaccinated on December 17th, right? And it was the second day Delaware had vaccinations. I was asked for some quote, like, why are you doing this? And my answer was, it's the right thing to do on many levels, right? And just kind of speaks to taking care of the community and other people and looking out for other people, having a civil responsibility and a civic responsibility. So, it's heartening for me to hear you say that.
Yeah, and it's thought of, and I know it's just not me that feels that way. There are several other people I definitely know from the politicians that I speak with weekly that it's on their mind as well, and the healthcare workers. I'm biased because I'm fortunate enough to go home to one every single night. My wife is a registered nurse, and so I hear about this, and a hospital administrator at that. So I hear
Right.
about this every single day. But I do know people. And there's no way that you can go to an environment such as a hospital in this time that we're going through and not have some type of mental health affection towards what's
Yeah.
going on and how that's going to play in your daily dealings with patients. So, in the
Yeah.
local community here in Wilmington, what can we do as far as testing or vaccination? What events or things that St. Francis is doing, or what are some recommendations that you would give?
Well, I know, I think most pharmacies offer boosters and vaccinations. I know that's where I got my booster, the first day I was eligible about 2 months ago. I just made an appointment at a Walgreens. First place that would take me, I went there. So I think most pharmacies have it. I think you have to make appointments online. Um, so St. Francis has a vaccine, clinic. I don't know whether it's still operational and to what degree it's operational. But I mean, it's definitely out there. I think that, it's a bit of a shame there's not, I think, with testing and with vaccinations at this point, the supply and demand being what it is, it's not as easy as it might have been in the past. And that's fueling this surge, I think.
Right. So, what do you think, in just your opinion, in the perfect world in which as lives, what are some barriers that we as a community can knock down to make readily available? Uh, what would you say to politicians and local community leaders out here that have their fingers on the pulse of what's going on and can make a decision or a phone call to knock down their vaccination or rest of the vaccine to people that are basically high risk and those that have not been vaccinated yet?
Yeah, it's a good question. I don't know how well I can speak to this. I mean, certainly making this easy, right? Making it really easy to get vaccinations, to get boosters, to get testing is really key. I mean, the one thing personally I say to some patients, right? Like, so often I'll see patients and they're not vaccinated, and one thing I hear quite frequently for some of the sick ones, they say, "Can I get it now?"
Right,
And I said, "Well, you can't really get it now, but here's what I want you to do is I want you to spread this word, right? That because a lot of patients never think it's going to happen to them, and it does, right? And they're surprised. And then so I kind of asked them, I said, you know what you can do? It's like, if you've got friends or family that, think, are anti-vax or whatever reason, tell them how scared you were, how sick you were. I think that's powerful. And it's
yeah,
very
I do.
believable, right?
I
Because
do too.
it's concrete. It's concrete for people, right? And I think part of the issue with, well, there's 800,000 people that have died, right? Like there's some quote, I forget who it was, Emerson, or said, oh, one death is a tragedy, more than that's a number, right? And we just have
Right.
people don't have a sense of the human tragedy, right, until it really affects them or someone close to them.
Right. Speaking of Emerson, he called it the loss of relatedness, right? So we have this force field around us, and that makes us feel as though it cannot happen to us. And I think that speaks to what he was going towards. But so having that relatedness of that was my cousin that died, or that was my friend that died, and I have had friends that have passed due to the COVID. Um, Disease, the virus, and I'm sure that you have had friends and colleagues as well that have passed. So it enters that bubble in which we live, and I wish it didn't have to come to that where you have to see someone or feel the loss of someone, before you make that decision. But you know what? That's the country in which we live right now, and the time in which we live, and unfortunately, it's affecting hospitals all over the country. And I want to bring up the fact that, and I'm sure that you're more than aware, is that our surrounding states are peaking as well. So you have
Mhm.
Maryland, Baltimore, and Washington D.C. and parts of New Jersey that are spiking right now. So these people, some of us are living in bedroom communities where, and by that we mean we sleep here at night, but we go to work in different states, and I'm one of those people as well. So, you know, we're surrounded by this vaccine, and they're not thinking about the protective measures of when they leave the house and how a mask is still necessary despite being vaccinated and boosted, and going to these peak areas and then bringing it back into your community.
Yeah, that's 100%. And it's so sad. And, frequently, right, it's the children that spread it to the older, people. And I remember last year after, Christmas and the holidays last year, I'd have sick patients with COVID and I'd say, well, have you been exposed to it? And say, no, I don't go out. I don't go out. And I say, well, what did you do last week for Christmas? Oh, my, kids came over and the cousins came over and like that was 4 days before, right? Like, and
Right.
so making that connection I mean, honestly, I've had that conversation. You've no idea how many times I've had that kind of conversation, right?
How do you keep a straight
And it's
face
sad.
as these people tell you? Yeah, you're right. You're right.
Honestly, it's sad, and sometimes it's very frustrating, right? Like it's very
Yeah.
frustrating, and and sometimes I, tell you the other day, there was a patient that was having increasing oxygen requirements, getting really sick, unvaccinated, and he was getting close to needing a ventilator, and he wanted to call his wife before he might be put on a ventilator because there's a 50% chance he might not get off that ventilator. And, he was there early 50s. He called his wife. And I spoke to his wife, and I think he spoke to his kids who are teenagers, right? And fortunately, he actually didn't need the ventilator, and I think he's doing okay. But I mean, for him,
Good news.
in that moment, there was a 50% chance this was the last conversation he was going to have with his wife and his kids. Like, this is heavy stuff, right? And
Right.
you could see the sorrow in his eyes. And he was one of the ones that asked, can he get, the nurse told me, he said, well, can I get vaccinated now? It's like, wow, that's so real and it's so deep and it's so heavy that I just kind of feel like if that was more in the news or whatever, like, or I think I said to him probably, look, I think you're going to get through this. I just want you to take this message back with you, right? So you can help other people. And
Right.
he like nodded and seemed to get it. And I'm like, wow, like the human suffering and the consequences of the decision not to be vaccinated are grave, right?
So, would you contribute how much of this, after having personal conversations with people that are not doing well from a physical perspective, how much of this would you contribute to misinformation versus them just wanting to not take part in it? How much of it is what they've heard on the news or what they've read online, and how much of that are they willing to tell you versus folks just not wanting to do it at all?
That's a really good question as well. I think the reasons are multifactorial. And when I'd ask patients, "Hey, are you vaccinated?" and they'd say no, and I'd say, "Well, why not? Like, what's stopping you?" Right? There were basically like six different, buckets, I would say, that people would answer. And some people were just scared, right? They're just scared, and they'd never had a conversation with a healthcare provider about this, right? So, like, kind of they were the easy ones to sit down and say, look, it's really safe. This is why. Da 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 da. You're in a safe place, and then you had more and more sort of extreme reasons not to that made less sense, or I'm doing my own research. Like, we hear that, like, I'm doing my own research. How do you respond to that?
I find it definitely interesting that you're saying, and I know that you're dealing with it more and more about not having a conversation with a healthcare provider, and that there is a deficit in regards to healthcare, especially in Black and Brown communities,
Hmm.
but also in lower income communities that
Hmm.
are agnostic to race. Finance has a lot to do with your healthcare, and whether or not it's misinformation, it could be as simple as just not having that conversation with a healthcare provider.
100%. I love that you said that because some of the best conversations I've had with patients have been those conversations. And there's some people, I remember one gentleman said, like I work 3 jobs. When was I going to go to the pharmacy? And I'm like, I hear you. We have it here for you right now. You want it now? Absolutely. Just needed the right, needed to be easy. Like works 3 jobs. Just not
Right.
on the forefront of his mind when he's trying to make ends meet, probably, right? So yeah, I think having those conversations, I learned a lot about the community, right? And some of the reasons, like they just needed someone to talk them through it, right? And not watch, again, and this is more the younger folk, like a TikTok video for their information.
Right. And so many people depend on that for the news. And that is not a healthcare provider. TikTok is not a healthcare provider.
No.
Instagram is not a licensed healthcare provider, nor is Facebook. Sometimes, Doc, you have to go slow with people in order for them to get it, but we
Mhm.
want them to hear it here first. Your doctor is the healthcare provider. Doctors such as Dr. Nesbitt here, who sees this every day and deals with it. Now, as the head of the emergency service department, you also handle most of the, I guess, the ambulances and all those emergency services throughout the city as well, correct?
Yeah, so the basic life support ambulances, right? So the St. Francis staffs the BLS service, basic life support, ambulances for the city of Wilmington. Yes.
Okay. And so have you noticed, I mean, this might be an obvious question, but are you noticing an influx of COVID calls out for EMS purposes?
Yes.
And that again is putting a strain on everyone, right? So these are EMS calls that could be going out doing everything else, but we're doing something. They're out handling COVID cases from people that are in desperate need, but may not have been in that desperate of a need if they were vaccinated.
100%. And also putting the EMS crews at risk as well, right? So, which is, sort of a double negative, and there've been a
Yeah,
number of infections within EMS, right? And
right.
partly probably for that reason.
It's a very difficult time for everyone. Uh, President Biden this afternoon had a conversation with all of the governors in the United States about the influx of the Omicron virus and how it's affecting healthcare systems throughout the country, and what plans are in place to ease certain things and problems that they're having now. Um, what would you ask for if this was Christmas yet again, and you could ask the president for something? What would St. Francis ask for in regards to help?
That's a good question as well. Uh, you know, I mean, more staff. I'm not sure that's a
Right.
realistic ask, because I don't think it exists. Um, but that would be number one. I think going back to doing everything that can be done to increase the availability of vaccinations, boosters, and testing, right? I do think I think I saw that they are sending out home testing kits, 500 million, I think I read. So I mean, I think that's a
Right.
start. It's something um, like that kind of thing. Yeah.
Regardless of the COVID vaccine, right now, I would agree. Would you agree that it is cold and flu season, right? So we may be dealing with some cold and flu symptoms. And I'm asking that to say, should we panic if we have sniffles? Should we run
Good
and grab
question.
a COVID kit? Or are you could be like my sons that play basketball in 35-degree weather with no jacket on? So, you know what I mean? Is
Okay.
that COVID? No, that's just cold.
Well, that's such a good question. There is a little bit of influenza, right? Last year, get this, in the state of Delaware last winter season, I think there were 4 cases of influenza, right? Normally there's like, I don't know, 30,000 or something, uh, or 10,000. So we saw no influenza last year. There's a little bit this year, but honestly, like,
Yeah.
If you have typical symptoms at this point in time in Delaware, the likelihood that it being COVID is quite high.
Really? Okay. Okay. Well, that's good to know. That's good to know. And do they need to come into the hospital, or should they try to get tested at Walgreens to purchase a rapid test, or
Yeah, that's a
what
great
is your?
question. So I think if you have symptoms that could be COVID, I think the safest thing, the best thing is to assume it is COVID. Not panic. Make sure you're wearing your mask. Keep your distance from family and whatnot. Limit interactions, and look for testing. But if you can't get a test that day and you have to wait a day or two, like as long as you're being sensible and using these precautions, that's okay. Like for particularly like for vaccinated patients, and younger vaccinated patients are very unlikely to get very sick from COVID, right? So they don't need to be coming to the emergency department, right? The emergency department should be more for older people. People are getting really short of breath, really dehydrated. But a lot of people are having mild symptoms with COVID-19 now. And again, why a lot? Because some of them are vaccinated, right? And some of them are young and would maybe have mild symptoms anyway. And again, that's not to downplay the dangers of COVID-19, right? But they just don't need to panic. Just assume it's probably COVID, wear your mask, keep your distance, let some other people know, and try and, get a test done, and, within 48 hours. I think that's the best advice.
Yeah, I mean the clock is running now for most parents. We have 4 to 5 days left of break before our youngsters go back to school. And so many college students will go back as well into regular session, regular semesters. Some colleges have decided to telecommute for the first semester or portions of the first semester, but most schools have basically said we'll take it on a case by case basis,
Yeah.
and they will re-engage here in the next week or so. What recommendations would you give as a physician, especially one in the emergency services department, to parents that are reluctant, but nonetheless will release their kids to go to school next week? What type of precautions would you give to them? Advice would you give to them to possibly ease their concern? Or would you just tell them to stay at home?
All right. Great question. So, one, back to vaccinations, right? Like, again, get vaccinated. If you're fully vaccinated, then yeah, could you still catch COVID? Yeah, you could, but it would probably be very mild, right? And also, the other thing that we didn't talk about yet is that, the belief is that if you're vaccinated and you have COVID, the number of days that it's transmissible, that you can spread it to others, is probably significantly less, right? So even if you do get a breakthrough case, right, the consequences of that for other people are less than if you were unvaccinated, right? So I think that's a key point. I think that schools have actually done quite a good job. I've got, two kids in college and one in high school, here in Wilmington, and I think the school did a fantastic job with masking and had very few cases. Now it's so prevalent now, I think it's a different beast now. But look, I think we all want our kids to be in school, right? We all want, kids want to be in college. I want them to be in college. I want them to be in school. And how do you do that reasonably safely? And again, it just comes back down to vaccination, right? Like, uh, COVID's not going away. I don't know how long it will be before COVID, if ever, is gone. But, at least if everyone was vaccinated, the degree of illnesses that people would suffer from it would be quite mild, and it just wouldn't be the same beast that it is now.
Talk about the amount of time that it would take for people to be separated before the spread of the virus. And I'm going to be frank, I don't know what those days are. Could you tell us what's the current recommendation?
It changes a lot. So there's, that's I I read up on this like every couple of weeks. What did the CDC? CDC just made some changes, right? Particularly with regard to healthcare workers. But for
Mhm.
breakthrough infections, I think they're now saying 5 days of isolation if you're asymptomatic after 5 days, in a vaccinated person, that you can kind of go back to your activities. Just make sure you wear a mask, properly for at least
Right.
another 5 days. So It's been, at least for healthcare workers, right? Because the CDC is very aware of the fact that healthcare is at a crisis point right now, like truly a crisis point. I've been in emergency medicine 15 years, and I remember H1N1 back in, I think it was 2009, and that was pretty bad. That, you know,
That was the
emergency
swine
departments were
flu, correct?
overwhelmed. The swine flu, yep, swine flu, I think it was 2009, 2008 into 2009. That was pretty bad. And it was pretty overwhelming to hospitals and emergency departments, right? But, this is, again, the lethality of this, the number of deaths from this greatly exceed the swine flu of that year. Um, so,
I just find it very difficult to accept again why some still are misinformed in regards to this. And I hope that the information that we're providing tonight will give those that are still on the fence an opportunity to hear great information, true information, not misinformation, and make that step towards vaccination. There are several places in the state. As simple as for myself, I received the booster 2 weeks ago at my local Super G. I picked up dinner and got a booster all at the same time. It was readily available. It's free, um,
mhm.
and it's for all of us to take and to support our healthcare workers that are out there right now that are truly on the front lines, that are making sacrifices of themselves and their families uh, to ensure our health. So we want to support you, Doc, any way we can. And if the only way that we can support you right now is to ensure that proper information is given to the folks here in the community, that's what we want to do.
I really appreciate those words. And that's a very good point as well. It's like there's so many inequalities in the US, right? But the one thing with vaccination is anyone can get it. It doesn't cost, you don't need insurance. It doesn't cost anything. You can just walk in and get it, right? So that's one of the great things, with the way this is being rolled out is that it's free. You don't need insurance. You don't need an insurance card. Just walk in and get it. It's that simple.
Yeah, it is that simple. And I'm going to be honest with you. I mean, my effects were minor. I had a sore arm. I had a little bit of a chill for about
Mhm.
5 or 6 hours that evening. And I took a couple ibuprofen. I was back up and running the next day. Similar happened with my original um, vaccination. Similar things, and but other than that, there was no large side effect. And I think
No.
a lot of folks are worried that have underlying issues are worried about the side effects that come from that. My parents, who are in their 70s, both of them had no side effect whatsoever. So
Mhm.
I'm fortunate for that. I hear that from a lot of people.
Right, and I think that kind of comes back to a little bit of the misunderstanding of numbers, right? So, with J&J, there was a lot of publicity over, a side effect, a blood clot. It was 1 in a million, right? Like, with kids and the vaccinations, there's been all this about, heart inflammation. Again, that's like 1 in a million that uh, self-resolves without any badness, usually, right? Like it just, again, not that you want to have it, but it's 1 in a million. So your chances of getting really sick from COVID, it's not, you know, not one in a
Right.
million. And honestly, I mean, we didn't really touch on kids, but there's some kids that have got really sick as well. I mean, kids, well, usually have very benign courses, mild, illnesses compared to older adults. Like there's some kids that have been sick and have been in pediatric ICUs, here in this state. So it's not like, oh, kids never get sick. We don't need to worry about them.
No, so and speaking in general terms, of course, I won't put you on the spot in regards to numbers, but from what you have seen as an emergency service provider, are more children being admitted into the ICU now than, say, earlier in 2020 with the initial variant or even the Delta variant prior to Omicron?
I don't know the data on that. I just know there has been a severe inflammatory response that has been seen, that has been described in the last few months in the US that wasn't reported on earlier on in the pandemic. Whether it just wasn't recognized and whether this is new. Again, these are relatively rare cases, but really bad cases where, children's organs basically shut down, right?
Right.
And very, very serious. And but I can't give you data on it, stats on it.
Right, and I'm sorry for putting you on the spot there, but I did as well notice this influx of young people that are affected by this disease and the vulnerability that they have because they're expecting and us as their elders to be their protectors and to ensure that they are safe and that they are doing what's necessary, and that when we believe misinformation in regards to COVID and we allow those ideas to I guess inflect in our home, we place our children in jeopardy. And that
Right.
also a tremendous strain on the healthcare system and its workers to constantly see these children that are coming in. And for things that, although, you've made it very clear, anybody can get COVID. But to bring it to fruition is that how your body responds to the COVID virus has a lot to do with whether or not you are vaccinated and whether or
Yeah.
not you have taken the steps necessary to protect your family.
Yeah, and the other thing that I don't think was messaged, has been messaged much, and which was clear since the beginning of the pandemic, is that the healthier you are, like that's protective, right? So, it was clear early, very early in the pandemic, that, obesity was a huge risk factor for bad outcomes. That smoking affects your lungs and whatnot, that like exercise is good, right? Like, so some of these things that are modifiable, I think I would have loved there be a little bit more focus on that. So like, hey, listen, if you do get COVID, and some people can get COVID, that if the healthier you are and you have control over that, right? Some control over that, then your outcome is likely to be better. So I think that's the other message, vaccination, 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 and then sort of do what you can with regards to smoking, exercise, weight loss, stuff like that, to reduce your risk factor of severe illness.
Earlier on, when COVID first hit back in March 2020, there were instructions in regards to prevention, right? We had to wear a mask.
Hmm.
Earlier on, it was which type of mask are we going to wear? Are we going to wear the gaiters or the mask masks that were made out of certain materials? Are we going to wear cloth
Yeah.
masks, N95 masks? Did we have to wash our hands? So on and so forth. Has any of that guidance changed?
I think with Omicron, well, I mean, cloth masks, the gator stuff, like we knew they really didn't, they never worked. I think that with Omicron, because it's so much more transmissible, that like a good fitting mask, a surgical mask is fine. I don't think it has to be an N95 mask, but just wearing the mask when you're close to people, right? Like, I think that's the most basic thing is like, yeah, cloth mask, gator mask, but put the mask on, if you're within 6 feet of someone. Again, I think the importance of it being well fitting and being decent is more important with Omicron, undoubtedly, but it just comes back to actually using it and maintaining a distance.
And using common sense, which sometimes isn't that
Right.
common. But if you're in an environment where you think you're going to need it, use it. Even if you're not
Yep.
sure you're going into an environment where you're not sure, that's another reason why you should use it, and
Hmm.
to cut down on the risk of bringing this virus into your
Hmm.
environment and into your community. Common
Yeah.
sense.
Yep. Totally.
So I don't want to be too graphic, but I want folks to understand what it's like and what is the experience of someone who is infected with COVID that has to come to the emergency department, and what are they going to expect? What is going to happen? Are they going to have tubes that are placed into their throat? Are they going to, be kept away from love for long periods of time? What are some things that they may expect?
Right. So I think one of the unfortunate but necessary things is that there's social isolation with this, right? So um, when someone's got COVID, they can't have visitors, right? And that's really sad. And I think that it's just sad, right? So that is one thing I think most hospitals Some have no visitors at all. We have limited visitor policy, but with COVID patients, they can't have visitors. I think that deterioration with COVID often takes days, several days. So if I admit someone who has a mild oxygen requirement, um, 3 days later might be when they're crashing and need a breathing tube in, right? And the tough thing is once that decision's made, is a lot of these patients are on a ventilator for considerable period of time. They don't get off quickly, if they survive it. And so so what I was telling you about the patient from the other day, I mean, that was like, and I explained that to him, right? Like, if you need to go on the ventilator, this is what happens. You'll be sedated, so you won't be, conscious, which you don't want to be conscious if you're on a ventilator. But, your ability
Right.
to communicate with the environment is gone, right? You're not talking to anyone if you're on the ventilator, and it's incredibly isolating. I imagine it's got to be incredibly tragically fearful and anxious for people that are aware of what's going on.
Yeah, absolutely. And not just for the person that this is going through, but for their families as well. And oftentimes, so many people may say, oh, well, I know Joe Blow and he got over COVID. He was just stayed at home for a week and he was fine. And it's important to know that that may not be your case, especially if you haven't seen a doctor regularly, especially if you're not doing the things that you've made very clear will help ease your COVID infection if you do have it, such as exercise, such as being in good health, not being obese. Prior to being infected with this. So, if you are having those underlying issues prior to, the likelihood the likelihood that you will be
Yes,
on a ventilator or some other harsher means is extremely high. Am I wrong, Doc?
yes. No, that's right. That you put it very well. Yep.
Just making sure that everyone is aware of these things. Working with other hospitals here in the city and in the state, what does St. Francis do, or how do all these hospital systems work together
Oh, that's a good
in
question as
regards
well.
to?
So one of the things that, because all the hospitals in Newcastle County, right, are really struggling and are sort of overwhelmed, right? So at times hospitals need to go and divert, which is basically a way for EMS to know, try not to bring any patients here because there's no place to put the patient, right? And so all the hospitals in Newcastle County can be on divert, but then there comes a point when not everyone can be on divert because the patients have to go somewhere. And that's kind of the situation we're in right now. I mean, that's how difficult and dire it is that you may have all the hospitals in Newcastle County going on divert, right? Which is a way of being like, please don't bring us any ambulances here. We don't have any room to put anyone. But all
Yeah.
hospitals can be on divert because then what what happens to that ambulance? What happens to that patient? So then everyone gets taken off divert and kind of suffer together. So there's this kind of communal inter-hospital, suffering for lack of a better term because, the system is stressed to a breaking point.
It sounds like it is. It really does sound like it is. And again, don't feel as though a lot of people say, oh well, I'll just go to Penn or I'll just drive down to Johns Hopkins or I'll run over the state line to wherever, whatever. So many other states are dealing with their issues as well. So don't think that you are going to go someplace else to be treated when in fact you're just going to get more of the same.
Right. Um, It is. Yeah, earlier today, I was actually interviewing an applicant, a physician who was applying to a job at St. Francis, and she's in Brooklyn. And so, she was there at the beginning of the pandemic and said, how is it now? And, she said, oh, it's actually better because New York's got a ton of, very high percentage of vaccinated patients, but this nursing staff shortage, she's putting the IVs in. She said last night there were 3 nurses when there should have been like, normally be 8, right? Like, that's tough, right? And that's New York,
That's
and
a deficit.
and
That's
so
not just tough. That's a deficit in care.
right. I mean, how do you get through that night? So she worked overnight. Like, how do you get through that night? And again, I think it speaks to the resilience of frontline workers. Like, wow, what a job, people do to get through that. Because those are like insurmountable odds for healthcare providers to try and provide care, right? And St. Francis hasn't been that bad of what she was telling me, but certainly Newcastle County and Delaware, all the hospitals feeling the same strain. It's tough.
And that's what it is. I mean, that's strain. I think that's a strain on our infrastructure. So many times during now, especially with all the things that are going on politically, the conversation that comes up is infrastructure, whether that's human infrastructure, the Build Back Better bill, or whether it's the infrastructure itself. Um, you know, this affects us as a country. It affects our
Mhm.
people. Those that are sick just aren't your uncle or your aunt. Those are our teachers. Those are our mechanics. Those are our engineers that are laying there in the hospital beds that are no longer able to help us do great things because they're affected or afflicted by this horrible virus. So we have to keep that in mind as well. One quick question about New Year's Eve. We're just a few days away from 2022 when so many people are celebrating and trying to put another year of COVID behind us. And true, it is a lot different than the empty Times Square of 2021. But now with 2022, what recommendations would you give to folks that are planning to gather and still may not or may feel comfortable in gathering in larger groups than what they did last year? They forward to it all year, and they probably did it for Christmas as well. Again, Dr. Nesbitt, what recommendations would you give to folks that are planning to venture out?
I mean, I guess outside rather than inside, um, not being in packed areas, um, keeping masks, face coverings on. Um, I want to say that you just really need to keep circles small. And again, like people just don't think it's going to happen to them, and it does, right? And if anyone sort of hears this message and hears how the infrastructure, the hospital systems are at near a breaking point, then I would just hope to just take a kind of a few seconds to think about that, and maybe that alters their choice of venue or limit the size of gatherings. Look, we all want to be social. Like I prefer to be out, see my friends and whatnot, but we just not now.
We're just not at that case. How long do
No.
you think? How much longer would you say, Dr. Nesbitt, will it be before we can actually get together and gather? Do you think it's going to be 2023 before that happens?
Wow, it's a tough question. I mean, it just there seems to be no end. There will be an end. Things will get better. It's just January is not going to be the month things get better, right? Like I actually think things will get worse before they get better, and I think January and probably February are going to be incredibly grueling and kind of depressing months from, a healthcare perspective and, from a, national perspective. So I don't really see the light at the end of the tunnel yet, but it will get better, but not in the near future, not with New Year coming up and how transmissible Omicron is.
Well, I thank you for being transparent and saying that right now you just don't see that light. You don't see the end of it yet. But I think now, just with my basic math knowledge, is that if you have the amount of people going up this way that are getting vaccinated, and versus the amount of cases that can actually occur and hospital visits, I know that there's a correlation of instance that's going to happen between those two things. So it is important again for those that are just tuning in, get vaccinated.
Right, right. And I think probably the best scenario might be that a few months from now, if enough people have been vaccinated, and honestly, I hate the talk of herd immunity because, with it is this sort of sense of, oh, well, let's just get it and get it over with so we can get it immunized. But people can be reinfected with COVID, and we didn't touch on that, but people have had COVID more than once, right? Because it changes, and so, you've had enough time pass since your prior infection, the virus changes, your immunity lags, like you can be reinfected. But I mean, I think maybe, 5, 6 months from now, best case scenario is like so many people are vaccinated, so many people have had it that the lethality of it is much, much less, and it doesn't pose the threat to the healthcare system that it did.
Just out of curiosity, you're talking about reinfection. What is the maximum number of times have you seen a patient that has been infected with?
I Personally, I mean, I've only seen it, I've seen a bunch of people that have been reinfected, so twice, but I don't have a better answer. I wish I had a better answer for you on that.
Wow. Yeah, and so you can't let your guard down, and it disputes the misinformation that, oh well, I've had it once, so I don't need to get vaccinated because I had it, that is my vaccination, and you've just made it very
Right.
clear that that is not the case.
Right, and that's what we see. If you say being vaccinated from an immunologic standpoint is similar to being infected, right? And we're seeing all these, number of breakthrough cases in people that had their vaccinations more than 6 months ago without boosters, right? Well, this logically the same thing as if you've had a prior infection, right? Like they go hand in hand. So yes, having had COVID, at one point, I guess maybe there was this belief, or we wanted to believe that COVID, well, maybe it would be around for 9 months and it'd be gone, and you had it once and you never get it again, and that's not the reality. That's not how it's turning
I
out.
mean, not being coy, but our former president made it very clear that it was going to go away in the summer, right? The hot months, it'll disappear in the heat.
Well, I think it was going to
So,
go away in April. I think there were 7 cases, and they'd be gone the next week, I think was the quote.
right, yeah, right. So you heard the same broadcast I did.
Uh-huh. Uh-huh. Yeah, and
Yeah.
bleach. Hmm.
Yes,
Hmm.
and the bleach, and
Uh-huh.
there was a light at some point. You could just use a light, and it would get rid of it.
Yeah.
So
Yes. In the emergency medicine community, there were a lot of jokes, that
oh yeah,
spurned
I can
came from.
imagine
I
the
mean,
memes that were being thrown around in the office about that, and especially the one in regards to the light and the heat and all that other stuff. Yeah, I bet it was a big
yeah,
laugh
yeah.
there in the
The
ER.
bleach was a classic. The bleach was classic. Uh-huh.
No one tried. You didn't
Mhm.
have anybody come in for poisoning, did you? For
Actually, what's interesting is that I personally didn't, but poison control started seeing spikes and stuff like that. Like seriously, like actually, there were cases of that. No, I didn't personally see them, but yes.
Common sense. Common sense. You have to
Hmm.
love it. Sometimes it's just
Hmm.
not common. Dr.
Hmm.
Nesbitt, your parting words. What are some that you would give to those that are viewing the program tonight and that took part in this great discussion that we've had today? What
Well, first of all,
advice
I
would
want
you
to
give them?
Well, first of all, I want to thank you for having me on. I really thought this was great. And if this conversation sways a few minds and gets, a bunch more people vaccinated and boosted and take common sense precautions, then, this has been a great service. So I guess that would be my, closing comments. But, thank you. I think your questions were enlightened, and you obviously know you've got a very good handle on this. Maybe some of the compliment goes to your wife, it sounds like, but it's been a
Absolutely.
pleasure.
That's brainwashing. That's home
Mhm,
brainwash
mhm,
that occurs, but it's effective nonetheless. But I'd like to echo some of that, Dr. Nesbitt. I would like to say thank
mhm,
you, and not just to you, but to all the healthcare workers that are in
mhm.
Wilmington, Newcastle County, Kent, Sussex, Delaware, I-state area across the country that are viewing this. I'd like to thank you for your sacrifices that you've made in order to keep this and bed down this horrible disease that's going on, this virus that is affecting so many lives and has taken so many lives throughout our country. We would like for you to stay strong. We would like for your minds to stay strong as well. I understand that it is very, very hard. And the amount of death and sickness that you've seen, we hope that you will come out of this better than what you've gone in and stronger than what you've gone in. And I would also like to encourage all those that are interested in nursing and that are interested in medicine
Yes.
to go ahead and be a part of it and work harder. And for those that
Mhm.
are on the fence and whether or not to apply or to apply to our local hospitals, absolutely apply. They would love to get the applications in. But more than anything, we
Totally.
want to try to curb some of that misinformation that's out there. We want to ensure that you, just not as viewers of the agenda and DETV and citizens of here in Wilmington and Newcastle County, we want you to understand that the misinformation is just that. It's not true. What is true is the vaccine and that it works and it is science and it is necessary in order for you to be stronger and be better for your community and to be the hero that we all know you can be. We'd like to thank you for joining us in this discussion tonight. Be sure to tune in later on this week. We'll have another hospital on and another medical professional on to talk to you and to curb some of that misinformation and let you know about why the vaccine is important and how it's affecting your community. We look forward to seeing you again right here on DETV.
This message is brought to you by Newcastle County Government.
The speed at which the vaccine has come about has given a few folks pause. But when you're losing 500,000 lives in a span of 6 to 8 months, you must respond quickly. The good news is the technology, the messenger RNA vaccination, is 30 years old. It's been in the lab waiting for the opportunity to take place. Now, most vaccines have taken years to perfect, but you weren't in the kind of crisis that we're in right now. I mean, this is the largest pandemic in 100 years. So you've got to respond quickly because it's responding quickly. And that's the misperception. It's old technology applied in a very new way for something that was deadly and continues to be.
This message is brought to you by Newcastle County Government.
Hi, I'm Dr. Neil Hochstein at ENT and Allergy of Delaware. We've been very fortunate to be protected from COVID-19 with the vaccines, but now we're hearing a lot about booster shots. If you're over 65 or have some immune compromise, booster shots are an effective way to strengthen your immune system again. It's the same vaccine that you received with your first or second dose, and it can extend and strengthen the protection that you've already received. Keep yourself and your friends and family safe. Thank you.
This message is brought to you by Newcastle County Government.
Many wonder, what is a variant? A variant is a mutation or a change in the genetic sequence of the virus. Some of our methods of treating COVID-19 become ineffective. If we were to simply get vaccinated, we could decrease the spread and the likelihood that a mutation would form in the first place. Let's get vaccinated.